BeCareLink, a digital health mobile app that benefits both doctors and their patients. The challenge facing neurologic patients and their providers is the growing shortage of neurologists. Currently, 75% of neurologic patients are treated by primary care doctors. The increasing burden on primary care providers and the lack of access to specialists is negatively impacting both patients and the primary care clinicians. For patients, this means long waits to see their primary care providers and sometimes inability to get access to specialists. The result is delayed diagnosis, delayed initiation of treatment, and worse patient outcomes. For primary care clinicians, it means overbooked schedules, inadequate time to address all the medical problems patients are experiencing, frustrated staff, and difficulty keeping their doors open financially. It also means having to treat conditions that they have not been trained to treat and feelings of inadequacy in giving the quality care they want to deliver. The increased patient burden with a fixed number of hours in the day also means a financial strain, requiring more staff and higher costs. Our solution? The BeCareLink mobile apps to quantify the neurologic exam. BeCareLink is a collection of mobile apps that quantify neurologic progression through remote gamified activities, provide evidence-based decision support, and which has validation in multiple clinical trials. Through gamified apps on their mobile phones, patients can assess their neurologic functions whenever, wherever, and send the results to their clinicians. The activities assess cognitive function, motor function, sensory function, ambulation, and more.
Vibration. Follow the vibration.
To your sensation.
Tap. Collect as many coins as possible.
Measures reaction time and cerebellar function.
Arm drift. See if your arms drift with your eyes closed.
Obviously, testing for cortical dysfunction, like a brain tumor or an MS flare.
Snellen. Test your visual acuity. Resting tremor. Determine if you have a resting tremor.
They put a pen under their phone, and we can...
Visual contrast. Test your color vision.
Parkinson's. This is for optic neuritis, so you're testing with an Ishihara test.
Cranial nerve test. Check if the nerves to your eyes and face work well.
Testing eye movements, facial asymmetry, and other cranial nerves.
Arm swing. Assess your arm swing.
Again, a very important test in assessing for Parkinson's.
25-foot walk. Measure how long it takes you to walk 25 feet.
That gives you a host of
Arm
information.
elevation. Let's move your arm up and down.
Motor strength.
Path. Drag the tiger along the path to the top.
Cerebellar and fine motor.
Timed up and go. Complete a set of movements in a short distance.
Very instrumental in MS evaluations and in Parkinson's.
Code. Translate digits to symbols using the provided key.
A cognitive assessment.
Stroop. Test your ability to process information.
Cognitive assessment.
Speech. Learn more about your speech.
Detects early Alzheimer's, MS flares, etc.
Transcription. Test how fast you can type.
Another cognitive test.
Overview. The percentile indicates how the patient performed relative to the general population, and patients can track their progress over time.
So patients immediately can see how they're doing, but then there's also a report that can be generated and sent to the clinician.
Hear from one of our users who has found the app to help her navigate her neurologic disease and continue to live a highly meaningful and fulfilled life.
I'm Sandy, and I was diagnosed with multiple sclerosis in 2014 when I could barely walk on my wedding day. I've had to really change my life a bit since then and find tools and resources that really work for me and my everyday life as a working mom. So it's things like obviously healthy diet and, keeping up with my meds and exercising. But I have also discovered this BeCare MS Link mobile app. What it does is it helps me track my MS symptoms, right? So I complete these real quick, kind of fun, gamified activities. And essentially, the AI technology is assessing my motor skills, my balance, my speech, etc. And it's then generating this very precise, quantifiable MS status, which is pretty cool because let's face it, my doctor appointments are few and far between. And when I do get to see the doctor, I can't remember what day I felt what way. So with this mobile app and using it at least on a monthly basis, it makes me feel like I'm in control, and it gives me peace of mind. And it reminds me I need to listen to my body.
The BeCareLink apps have received multiple recognitions for innovation and for the impact they make in improving healthcare delivery. The BeCare platform has multiple apps already available and in development to meet the needs of clinicians and their patients. Patients, empower yourselves to become a driver in your neurologic healthcare. Clinicians, use digital health enabled by AI to deliver the most effective healthcare and to lighten your burdens so you can spend the time doing what you love most, helping your patients.